I receive very generous compensation, but I don't know the exact number that you're referring to.
In fact, you personally received $500,000 personally just by tripling the price of Revlimid. So to recap here, the drug didn't get any better, the cancer patients didn't get any better, you just got better at making money. You just refined your skills at price gouging.
I do want you to take a minute to watch this entire exchange. It's about 4 minutes long, but it's critically important because what Representative Katie Porter is doing here is exposing the extent to which individuals benefit off of the misery of Americans, off of the misery of people fighting cancer. Take a listen in.
I understand your question about the pill. The manufacturing for it would be the same.
Great, thank you. So to put that in perspective, you hiked the price by $500 when the average Orange County senior only has $528 left in their bank account after they've paid their basic monthly expenses. The average Orange County senior can't even afford one pill. And you said recently that nobody pays the list price, but that is not correct. Do uninsured patients sometimes pay the list price?
I can imagine there are circumstances where underinsured or uninsured patients would be paying close to or at the list price. I don't know of any specific circumstances, but I would
reclaiming my
guess
time,
that they do
Mr. Ollis.
exist.
I want to turn to one other number if you would help me. Do you know what this number is? Does it ring any bells?
But I think you're referring to my compensation in some way.
Yeah, well, in some way. This was your compensation in 2017 for being CEO of Celgene, and that's a lot of money. It's 200 times the average American's income and 360 times what the average senior gets on Social Security. Now, of that 13 million, about 2.1 million came from your company hitting yearly earning targets. And more than half of the bonus formula was based on those targets. Any increase in the price of Revlimid would also increase your bonus by increasing earnings. Isn't that right, Mr. Ellis?
If revenues increased and expenses did not, then earnings would be enhanced.
Thank you. Mr. Ellis, in fact, the Oversight Committee found that if you hadn't increased the price of Revlimid, you wouldn't have gotten your bonus. Mr. Ellis, do you know how much you personally received in bonuses over 2 years, the last 2 years, just because Celgene raised the price of this one drug, Revlimid?
I receive very generous compensation, but I don't know the exact number that you're referring to.
In fact, you personally received $500,000 personally just by tripling the price of Revlimid. So to recap here, the drug didn't get any better, the cancer patients didn't get any better, you just got better at making money. You just refined your skills at price gouging. And to be clear, the taxpayers spent $3.3 billion on Revlimid, 3.3 Medicare, $3.3 billion.
I want to take a second for you to let this just digest. What Representative Porter is doing here is so vitally important. It is exposing the extent to which people make a profit, an obscene profit, off of individuals fighting cancer. It cuts to the core of our situation in this for-profit medical industry that we have in the United States. That this one man, this one CEO could benefit by hiking the price, adding $500 to the price of a life-saving cancer medication. The drug didn't get any better. It didn't help anyone any quicker. It didn't become more efficient to produce. It was already efficient to produce, and taxpayers spent billions on it. And yet he had no problem price gouging so that he can get a multi-million-dollar bonus. This is the inherent problem of having a healthcare system that benefits and profits individuals at the expense of the misery of others. People are fighting for their lives. They're fighting cancer, but we have an entire industry of people who can make millions of dollars off of people fighting leukemia, cancer, HIV, diabetes. It is morally reprehensible. It is wrong. There should be no profit motive in helping people with cancer. There should be no profit motive in an industry where people are fighting for their lives. They are desperate. And because they are desperate, these companies know that they can hike the price to $500 higher per pill. Per pill. And to add insult to injury is the fact that there are so many Americans who don't have health care, that are uninsured and have to pay the full price for this. The full $700 per pill. This is the obscenity of America's healthcare system. This is morally reprehensible and it is wrong, and we cannot tolerate it. We cannot tolerate it any longer.
Mr. Ellis, do you know how much you personally received in bonuses over 2 years, the last 2 years, just because Celgene raised the price of this one drug, Revlimid?
I receive very generous compensation, but I don't know the exact number that you're referring to.
In fact, you personally received $500,000 personally just by tripling the price of Revlimid. So to recap here, the drug didn't get any better. The cancer patients didn't get any better. You just got better at making money. You just refined your skills at price gouging.